Hi, everyone. Good morning, and welcome to the 2022
Hold
SCID
on,
Compass
not yet.
Summit.
Hold on. Now go. It should be live.
Hi, everyone. Good morning, and welcome to the 2022 SCID Compass Summit. We know everyone is joining via live stream, so we're going to give it just a couple minutes for folks to sign on, and then we'll go ahead and get started. Thank you. All right, good morning, everyone, and welcome to the opening session and kickoff for the Immune Deficiency Foundation's 4th Annual SCID Compass Summit. My name is Emma Mertens, and I'm the Program Manager of Community Relations here at IDF. On behalf of all of us at both IDF and our SCID Compass partners, I'd like to thank you for joining us today for this program. We are so excited to host this event for the SCID community. It's hard to believe that we are here hosting our 4th and final iteration of this event to highlight programs and resources for the SCID community. Today, we're going to start off with a little bit of orienting and housekeeping before we jump into why we're here today. Please note, the information presented during this event is not medical advice, nor is it intended to be a substitute for medical advice, diagnosis, or treatment. Always seek the advice of a physician or other qualified health provider with any questions concerning a medical condition. Never disregard professional medical advice or delay seeking it based on information presented during the event. For over 40 years, the Immune Deficiency Foundation has served as the trusted organization for the primary immunodeficiency community, with a mission of improving the diagnosis, treatment, and quality of life of people affected by primary immunodeficiency, also called PI, through fostering a community empowered by advocacy, education, and research. We truly value our role as a patient advocacy organization. SCID Compass is not a standalone program, but part of a greater community of people living with primary immunodeficiency, of which there are over 450 types. As a result of our mission, IDF seeks to ensure that everyone in the US affected by PI has a fully informed understanding of the diagnosis that affects them, all available treatment options, the expected standard of care, and all of their opportunities for connection and support within the PI community. IDF offers year-round virtual and in-person programming for individuals across the lifespan navigating some form of PI. One of those programs is our Walk for PI, which returns in full force this fall with 11 walks happening all over the US, plus a coast-to-coast option for those who want to walk in their own communities. For more information and to create or join a team, visit walkforpi.org. We are also thrilled to share that our Teen Escape program is returning this summer, taking place both in person and virtually on July 22nd to the 24th in the Chicagoland area. There will be programming for teens ages 13 to 17 living with PI and their parents, in addition to young adults ages 18 to 25 with PI. Please keep an eye open for additional information about the escape and how to register. The final save the date is for this year's PI conference. It will be a hybrid event held on October 6th through the 8th. Virtual education and networking sessions will be offered throughout the conference. However, the final day of the conference will include the opportunity to meet in person in 3 locations: Southern California, Illinois, and Maryland. There will be diagnosis-specific sessions in which SCID is included, as well as general sessions and information for living your best life with PI. More information coming soon. And of course, in this digital age, you can find IDF all over social media, sharing stories, resources, and news. Check us out on Facebook, Twitter, Instagram, and LinkedIn. So you might be asking, what can you expect over the next 2 days? This year, we've put together a program that highlights all of the work we've been completing this year and really showcases the program we've created. As I mentioned in my opening welcome, this is our 4th and final summit, and our grant with HRSA closes out at the end of July. So we're using today and tomorrow to really highlight our work. On the next two slides, you'll see our agenda for over the next 2 days, and we're so excited to share this great lineup of presentations with you all. You may have noticed that some sessions might overlap, but not to worry because all sessions will be available on demand in the Attendee Hub immediately after they have streamed. So if you miss a session, no worries. Additionally, all sessions will be uploaded to skidcompass.org as well as the IDF YouTube channel this summer. And with that, I will now turn it over to Alyssa Creamer, IDF's Director of Community Services.
Thank you, Emma, and hello, everyone. That was a lot of housekeeping, so thank you all for indulging us for a few minutes to share all the great things that are happening at IDF, not just in the SCID community through SCID Compass. As Emma mentioned, my name is Alyssa Creamer, and I'm the Director of Community Services at IDF, and I'm here to share lots of our programmatic information with you all. And it's so exciting to be here for our 4th summit. I see so many names and faces that I recognize going back to our first summit that was in person in 2019. And it's just really been fun to be part of this program since the start. So many of you turning in today are doing so because you are an individual, a parent, a caregiver, or just a friend to someone living with severe combined immunodeficiency or SCID. Many of you also work in newborn screening, and depending on what state you live and work in, you might be that first person who tells a new parent that their newborn may have SCID. So no matter where you fall along the SCID journey, your role is important, and I'm so glad you're here to help support others on their way. SCID Compass, an educational program of the Immune Deficiency Foundation, is designed to guide parents of children diagnosed with SCID, people living with SCID, and the medical community through the journey of learning about this rare and life-threatening medical disorder and helping those find support to navigate the health challenges along the way. This project launched in late 2018 before all states were screening for SCID, but the end was certainly in sight. Over the past 4 years, we've launched surveys, studies, and created many resources for those navigating a SCID diagnosis. And today and tomorrow, we're going to highlight a lot of that work, but I also encourage you to join the closing session where you'll learn how to navigate our website and easily discover anything and everything you could be looking for yourself or to share with a patient, a family, or even a colleague. SCID Compass is supported by a grant through the Health Resources and Services Administration, or HRSA, which is an agency of the U.S. Department of Health and Human Services. SCID Compass was developed through a partnership between the Immune Deficiency Foundation, RTI International, and the Association of Public Health Laboratories, with support from Expecting Health, the SCID Angels for Life Foundation, and the Primary Immune Deficiency Treatment Consortium. This dedicated group of individuals met every other week since September 2018 to build this program. We have been privileged to have some individuals with us since the very beginning and others who've only joined us over the past year. However, every single person has brought tremendous experience, insight, and passion to this project. I would also like to extend a heartfelt thank you to the 15 parents, adult patients, and professionals who have served on our steering committee and parent-patient advisory board over the past 4 years. These individuals provided our team with much needed guidance and personal experience as we set out to build this program. I would also like to give a very generous thank you to Dr. Jack Rudis of the Medical College of Wisconsin, who served as our medical director for this program, ensuring that everything we created was medically accurate and appropriate. And finally, I want to give a thank you to all of the parents who shared their time and their stories with us, whether it was completing one of our many surveys, participating in a focus group, user testing our resources, or being interviewed for a blog post or a video. This program would not be what it is without parents and families taking time out of their very busy lives to share their journeys with SCID with our team. One of the biggest needs identified at the start of this program was to highlight stories of real families who've received a SCID diagnosis. And that wouldn't be possible without having actual parents willing to share their stories. I wish I could play a photo montage and share images of each family who opened their lives to us, the good, the bad, the stressful, and the inspiring. We are indebted to each and every one of them and offer our thanks to Heather Smith of SCID Angels for Life for connecting us with so many incredible and outstanding parents. Thank you. So while our grant and the world certainly has changed significantly since we were first awarded this project in the summer of 2018, I wanted to at least share our original goals and level set with you all about what our original purpose of this program was. So in 2018, we set out to increase awareness and knowledge about SCID, support state newborn screening programs, link families with children with SCID to clinical centers with experience in treatment and management of SCID, and also develop strategies for long-term follow-up. As you'll hear more today and tomorrow, we have touched on each of these goals. We even learned pretty early on that long-term follow-up is an incredible need for this community and would probably need its own dedicated program and focus beyond our educational program. And you'll hear more about that tomorrow. So we were driven to be data-driven with our work in order to create a program that would fulfill the actual needs of those navigating SCID. We distributed several surveys and conducted many interviews with parents in order to guide our work. On your screen are just some snapshots of only 3 of our data collection methods, one for parents, one for providers, and one for our newborn screening programs. While there are only 3 on your screen, I assure you that there were many, many more that all can't be shown on this slide. So from all of those surveys, we identified needs for both parents and caregivers and providers. From understanding the available treatment options to needing to understand the various types of SCID, because there isn't just one, to reading stories about real families and coping with the uncertainty of it all. These reported needs drove the creation of everything you're going to hear about today and tomorrow. If you've joined us since the start of this program or even our first summit in 2019, this slide will look very familiar for you. Really one of the first things we did was create a journey map and identify a general SCID journey based on interviews with a variety of parents of children with SCID at varying points in their diagnosis. So this journey map has served as the basis for our website design and the resources that were needed at various points. We even created an animated series based on this journey map, and it outlines the diagnosis, the pre-treatment, treatment, post-treatment, new normal, and all the emotions, the challenges and pain points, information needs, and the components that made a difference along these parents' generalized journey. So while we were doing all of that, APHL was also hard at work supporting state-level newborn screening programs. As mentioned a little earlier, when we were awarded this grant and started on this program, not all states were screening for SCID, and some had only recently started to implement screening. APHL conducted a needs assessment survey and RFP process to determine the level and support that state programs were going to require from APHL to support this new screening process or to work out the kinks. Throughout the grant, APHL provided funding and technical assistance to support many states in their implementation of SCID newborn screening. Support from APHL took many forms, including equipment, instrumentation upgrades, maintenance, and training, ensuring quick testing for families across the US. Later today, you'll also hear from APHL about some preliminary findings from their quality improvement study to support screening of premature infants. So when we set out to do this work, we knew a website would be a key component and that we'd need to design a place to direct people to learn anything and everything about SCID. So what you're seeing on your screen, which is just a screenshot of our homepage, did not exist until December 2019. So prior to SCID Compass, information about SCID was scattered all over the internet from a variety of sources. There was no one-stop shop or one hub for people to go to find accurate information about SCID. So we knew we'd need to create a programmatic website encompassing a breadth of not only information, but news and those much needed stories about SCID all in one place. So we've come a long way and are thrilled to share some of the things we've created that now live on this website and are easy to find. So SCIDcompass.org is that one-stop shop for anyone who's interested in learning more about how to navigate a SCID diagnosis. So the website, again, it's www.scidcompass.org, offers information about every step in that SCID journey, from newborn screening and diagnosis to the various SCID types, the treatments, tips on how to advocate for your child, how to take care of your own mental health as a caregiver, or even hearing the latest in news about SCID. We also know that we are not the experts in everything, and there are a lot of great organizations that also provide information on SCID. So we link out to as many of those great organizations and resources that we can, including NBSTRN, Genetic Alliance and Expecting Health, and APHL's New Steps program, as well as the NIH, CIS, PIDTC, all of those great resources that many people know about. If you haven't been on our website in a while, I encourage you to explore. We are adding content and resources all the time. The website itself is available in 5 total languages other than English. That includes Spanish, French, German, Portuguese, and Tagalog. And you can find these other sites by clicking on Select a Language in the upper navigation of the English website. And it'll take you exactly where you need to go. We also have a SCID Compass Toolkit, which is a condensed, downloadable, and also printable version of the website that is available in 12 total languages, including English, Spanish, French, Portuguese, German, Simple Mandarin, Tagalog, Hebrew, Korean, Vietnamese, Dina Bazad, which is the language of the Navajo Nation, and Arabic. These languages account for some of the most common languages spoken in the US. We know that not every parent who has a child born or treated for SCID in the US speaks English proficiently. We wanted to ensure that all families navigating a SCID diagnosis can receive accurate and supportive information and resources in a language that they understand, because SCID can be scary. I also want to take this time to mention that while SCID is a complex diagnosis and its treatment is even more complex, we've done our best to make sure that the website and all the resources we've created are written in as plain and easy to understand language as possible. The majority of the website is written in an 8th grade level, ensuring anyone, no matter their educational attainment, can comprehend all that is involved with a SCID diagnosis. Now, we wouldn't be a very good education program if we didn't start at the beginning by providing information and education about newborn screening and newborn screening for SCID. How to interpret those results, what really is newborn screening, and also offering a little history about how newborn screening for SCID came to be. This page on the website is usually one of the top 5 most visited on our SCID Compass site every month, showing that many individuals get that call or that letter from their provider saying that their child has screened abnormal for something called SCID. And parents are turning to the internet to learn more about what that means, and many of them are finding us. To get this factually correct information about our website and information about SCID directly to parents and to providers in those very early days between screening and confirmatory testing, the RTI team created 2 newborn screening fact sheets. One is for parents and one is for any type of healthcare provider. And these are meant to provide quick information about SCID, answer some frequently asked questions, and direct individuals to resources like IDF, SCID Compass, and SCID Angels for Life Foundation. We're thrilled to say that many states' newborn screening follow-up programs already share these documents with their families with abnormal screens. These documents are free and downloadable on our website and can be customized with your program's information and contact directly on the back. If you don't use these yet and you'd like to start distributing them through your program, you can give us a call or email us at skidcompass@primaryimmune.org. They're also downloadable on our website, so you can easily start using them and sharing them with the families you work with or even the providers you work with. We find that these are really helpful to give out to primary care providers who are usually, sometimes, depending on the state you're in, the one that has to call families. So this gives them a quick refresher of what SCID is and important things to keep in mind, especially for those providers who maybe don't see SCID all that often and aren't very familiar with it. We heard from providers and parents that it's not enough to just provide information on SCID, but what about all the details, decisions, and information that come along with a confirmed diagnosis? How do you cope with isolation? How do you prepare your home for life post-treatment? How do you pay for all of the treatments and the hospital stays? What if I'm thinking about having future children and I already have one child with SCID? We definitely have you covered on all areas. The support and resources pages on the website offer a breadth of information about navigating the non-medical aspects of SCID. And the best part is that a lot of this information is applicable to anyone navigating a hospital stay or a complex diagnosis. So maybe you found SCID Compass because your child received an abnormal screen for SCID, but through confirmatory testing led to a different diagnosis, such as congenital athymia. Many of those individuals will still benefit from the resources that we have on our site. Another highly requested and very popular webpage is our SCID treatment and types overview. Here we provide in-depth information about the 13 plus types of SCID and the 3 most common treatments for SCID based on the type you have. It's not enough for a child to be diagnosed with SCID, but to learn that there are varying types that will influence the treatment plan can be even more confusing for parents. Further, some children undergo pre-treatment conditioning prior to hematopoietic stem cell transplantation. And we learned from interviews with parents that this treatment decision can be a confusing one. Some children get it and some children don't. So we created a pre-treatment conditioning page that answers some frequently asked questions and also gives parents some questions to ask their provider about this option so they feel informed about whether or not it's happening to their child. Like the newborn screening pages, this webpage on the SCID types and the SCID treatments are some of the most popular each month as well. And here's just a glimpse again at some of the resources we've created over the past year. The Expecting Health team will share information about their family planning resource, which grew out of conversations with parents who already have one child with SCID and wondered about what the future held for them to have additional children. And again, all of these are available on our website, but also compiled in our downloadable and printable toolkit that is available in 12 total languages. So you can get these parent and provider fact sheets, as well as the family planning, thinking about the future worksheet in Spanish, in Portuguese, in Dina Bazad. It's available for anyone in any language and available for free. So we know that a SCID diagnosis is not one that just impacts the infant, but the entire family unit. So we have resources that help parents navigate this diagnosis as a family. from our animated SCID journey series, which was born out of that original journey map and follows a fictional family through a SCID diagnosis from birth to school aged. This is also in Spanish and is a great resource for families who are looking for a bite-sized understanding of the SCID journey and something that they can share with other members of their family. We also have a recent podcast about supporting siblings of children with chronic illness. And we also share stories from parent perspectives, including a recent panel of SCID carriers and how each of them navigated their decision to grow their families, knowing that they are genetic carriers of SCID already. There are plenty of opportunities for learning and support for whatever your needs may be across the journey. If you want to hear about one family's experience at a certain point in the journey, such as right at diagnosis, navigating that hospital stay, or entering the new normal, like going off to kindergarten, we have a Q&A series with a few families who do just that. You can hear from the Dugans, the Billy Georges, the Hargroves, and the Woos as they share their own personal experiences navigating SCID at a certain point in their journey. Now, this is just a snippet of the over 14 parents and adults with SCID that we've highlighted so far in this program. Tomorrow, you can tune in to hear Heather Smith of SCID Angels for Life interview Angie Kotarski about her family's experience when her son Miles was diagnosed with a very rare type of SCID. I promise you this is a story you do not want to miss, and you also might want to have some tissues on hand, and that's just a disclaimer ahead of time. But it's a very powerful story that Angie is going to talk us through. As we live in an increasingly digital world, the majority of our programming is provided in a variety of formats. And this is really to suit the needs of the SCID and the PI community. We offer programs in live webinar format. We offer podcasts. We offer standard news and blog updates, really anything and everything about SCID in any type of format that you like to learn in. In fact, our 6 SCID-related podcasts, which are hosted on IDF's Have You Heard podcast, have been streamed over 4,000 times. So no matter how you like to learn, we offer programming in a format that fits your needs. And like all of our resources on our website, everything that we create that is educational and related to SCID is free for anyone to access. As mentioned at the beginning of this presentation, all of the decisions made in this program have been data-driven, and we've shared that data so far in the form of 3 peer-reviewed manuscripts, which were published in Frontiers in Immunology and Frontiers in Pediatrics. In the coming months, we expect to have at least 7 more manuscripts published on our work, our findings, and our lessons learned. I mentioned in the beginning that I could only show on the slide 3 different surveys that we were able to put out, but we have done so much more surveys and user testing and interviews with families that we are really looking forward to sharing that data and that insight with the peer-reviewed and medical world. So please stay tuned for more. We also know that news about SCID is nonstop, and we work hard to publish monthly blogs and news updates highlighting what's going on in the SCID sphere. We offer monthly free webinars for the SCID and IDF community. And these 60-minute presentations are on topical information and are provided by experts in the field, and participants can ask questions in real time. We have covered a lot of topics, from newborn screening lab processes in North Carolina to how to access telehealth services. We've answered the question, what is the PIDTC, and everything in between. We hope you'll join us as we continue to highlight lunch and learns for SCID and other conditions each month. Our next SCID Lunch and Learn is in August on B cell reconstitution and IgG infusions in partnership with California SCID. More information and registration will be open later in July. These webinars have been so popular that we've begun offering them for other diagnoses through IDF. Just yesterday, we held a congenital athymia lunch and learn, and so far this year, other diagnoses we've covered are WHIM syndrome, hyper-IgM, Wiskott-Aldrich, and CGD. And this fall, we have APDS, HLH, and LAD1, LAD2 later this fall. We also provide and link to a variety of opportunities for connections and support. We offer a virtual caregivers group that is a monthly support group for caregivers to people with PI, including SCID. This group is facilitated by a licensed mental health professional and helps guide conversations around how to cope with being a caregiver to those with life-threatening and chronic conditions. IDF also offers volunteer-led Get Connected groups, which are also offered virtually and all over the US. Through these Get Connected groups, 2 of them are parent-specific Get Connected groups, one of which is led by a parent of a teen with SCID. These Get Connected groups are a great opportunity to meet other parents or other individuals with PI, and they have young kids as well who have all types of PI and can connect and learn from one another. There's also the SCID Angels for Life Foundation, which is an incredible resource for parents of children with SCID. And then finally, RTI will share some work and a resource for coping with your mental health after a SCID diagnosis later this morning. Today, you'll also have the opportunity to hear about 2 studies that we've been able to sponsor through the SCID Compass program. One is a neurodevelopmental outcome study in partnership with the PIDTC, looking at outcomes of children diagnosed and receiving pre-treatment conditioning prior to HSCT for SCID. The other is Dr. Yolan Walter of the University of South Florida, looking at ADA SCID variants in the Irish traveler community. We are pleased to be able to support research that will influence the next steps in supporting those diagnosed with SCID, especially those in underserved communities. And we hope to share findings from both of these studies during future lunch and learns. So please be on the lookout for when those are scheduled and happening. So it goes without saying that this program has made an impression on the SCID community. Now, since the website launched in December 2019, which was about 2.5 years ago, we've had 132,506 unique web visitors. I will say that these numbers were pulled on Monday, so the number is likely even higher today. I think what that means is that 132,000 plus people have looked for information specifically about SCID, which is a rare disease with less than 100 people diagnosed in the US each year. SCID Compass related news, social media posts have also made over 300,000 impressions on social media since we started tracking in 2018. That's people who have liked, loved, viewed, or shared something related to SCID and SCID Compass on Facebook, Twitter, Instagram, and LinkedIn. Also on the screen, you can see 2 graphs. Most people find us and SCID Compass through just an organic search on like Google, typing in various keywords. Maybe it's even SCID Compass directly, but most of our traffic comes from organic searches. The next biggest bucket is direct, so people who type in skidcompass.org directly into their web browser and find us. The next is referral sources, so other programs who have us linked on their website. So like PIDTC might have a link to SCID Compass, SCID Angels for Life may have a link to SCID Compass, NOR, the National Organization of Rare Diseases, may link to us as well, so people find us that way. And then social media is the next smallest sliver. So people who follow us on Facebook and click on some sort of link and take them directly to the website. So while SCID Compass and IDF are focused on sharing information about SCID in the US, we know that our resources can be applicable and really fill a gap for people who are living all over the world. We know that many people look to the US and IDF and the SCID Compass program to set an example of how research, advocacy, and education can really intersect to support a patient community. So as more countries are initiating newborn screening for SCID, we know we got a head start on them. So many of them are looking to us at how to navigate this journey. So you can see based on that heat map, all the places in the world where people are finding us, which is just really exciting that people not just in the US, but all over are benefiting from the information that we have to share. So what's next? As Emma mentioned, our grant is ending in the end of July, but that does not mean that our work really stops. So in the coming weeks, we'll still be rolling out a few more resources that we have yet to finalize. One of them is a questions to ask your healthcare provider resource, and also an animated video about navigating family planning, similar to the animated journey videos that we've already created. We're also hosting a SCID Education Day for the Amish and Mennonite community in partnership with the Clinic for Special Children in Strasburg, Pennsylvania. We'll be bringing together experts in SCID, as well as hard copies of all of our resources to this underserved community. We're also working diligently to write, as I mentioned, quite a few manuscripts that will demonstrate our work and hopefully set an example for future comprehensive education programs that will complement conditions on the newborn screening panel. One program that you'll hear about tomorrow is a long-term follow-up program called CalSCID. Dr. Morna Dorsey, who is the project director at UCSF, will share more information at 11 a.m. A component of her work is to complete a long-term follow-up needs assessment of parents of children with SCID in the US. So if you are a parent of a child with SCID, or even if you are an adult with SCID, you fall into this category and can take this survey. Please scan the QR code that is on your screen to complete it. It takes 30 minutes or less, likely less, and will provide valuable information for designing a long-term follow-up program for SCID that could be used as a model for future state partnerships and hospital partnerships. So that's kind of it, at least for this morning's kickoff. We have been able to provide so much to the SCID community over the past 4 years and are honored to share it with you all today. Even though our grant is ending, this program really is not. SCID Compass is part of the greater IDF portfolio of services, and we'll continue to operate and support those living with and navigating a SCID diagnosis. So you'll continue to hear from us and see us work from us in the coming months and years as we share our resources with the SCID and medical community. If you'd like to stay in touch with all that we are continuing to do, I really encourage you to sign up for email and news alerts through IDF. You can do so by going to the SCID Compass website and clicking on My Account, which will be in the upper navigation. You can choose the level of interaction you have from IDF in regards to emails, meaning you can be a power reader, meaning you'll get everything that we put out as news and updates. The next level, I think, is curated, so you'll get a digest of things here and there, or you can be a basic, maybe getting 1 or less emails a week. So you can really control how much you're seeing or hearing from us. I also encourage you to follow us on social media. We're on all of the platforms, so whatever works for you, we hope you'll find us there. And as always, you can always reach out to us with questions. Our email address, or the most basic one where you can find any of us, is at scidcompass@primaryimmune.org. That is monitored all week by a member of our team, and we are happy to answer any questions, send you any resources, especially if you are at a newborn screening program and you want to share those parent and provider fact sheets. We are happy to get those to you. Or if you have a topic for a lunch and learn, or you'd like to share your story with us and be a part of the several families who have told their story, we would love to hear from you and be able to highlight your journey. So the best place to do that, again, is just sending us a quick email at scidcompass@primaryimmune.org. So I think that's where I will leave off for now. Our next session is being presented by RTI about mental health and coping with a SCID diagnosis. They are debuting a really powerful video that was done with some interviews of parents as well as a mental health provider that I think will be a really great resource for the SCID community, and is just a really good reminder to take good care of yourself when you're caring for others. So with that, I will see you again at 12:10 p.m. Eastern and throughout the rest of the summit. Welcome, everyone. It's so great to be here and to see all of you. And I just thank you all for being here. Take care.